Hey everyone, Dr. Gino Spigarelli here, and welcome back to the channel. Today we're talking about something you've probably had done at least once in your life, an X-ray. But have you ever wondered how X are really looking at when they read one? Well, let's break it down in simple terms. An X-ray is basically a special kind of light, except instead of what we can see with our eyes, it's an invisible form of energy that can pass right through the body. But here's the cool part, it doesn't pass through everything equally. Dense stuff like bones block most of the X-rays. That's why bones show up bright white on an X-ray image. Meanwhile, softer stuff like muscles, organs, and fat let more X-rays through, so they look gray or darker on the picture. When you go in for an X-ray, the technician positions you between the X-ray machine and a special detector, kind of like a camera that catches the rays on the other side. They aim the beam only at the area that needs to be seen, then send a quick pulse of X-rays through your body. It only takes a second, and that invisible energy creates a shadow image on the detector. That shadow is instantly turned into a digital picture that the radiologist can study on a computer screen. Now, if the X-ray is near your reproductive organs, the staff takes extra precautions. They might use a lead shield, a protective apron that blocks radiation from reaching sensitive areas like the testes or ovaries. They also narrow the beam so it only hits the exact area they need to see and use the lowest dose possible to still get a clear image. So don't worry, the amount of radiation is very small and carefully controlled. When a radiologist reads an X-ray, they're looking at shades of white and gray to spot anything that doesn't look normal. They check things like bone alignment, density, and the spacing between joints. They also look for unusual shadows or bright spots that could mean swelling, infection, or other issues. It takes years of training to recognize tiny details that most of us would miss. Even though X-rays use radiation, the exposure is incredibly low, kind of like what you'd get from a few days of natural background radiation. The key point is that the diagnostic benefits far outweigh the risks, so the next time you're getting an X-ray, you'll know exactly what's happening and how that image helps doctors see what's going on inside your body safely and quickly. If you found this helpful, hit that like button, subscribe for more science breakdowns, and let me know in the comments what medical topic you want me to explain next. Thanks